patient-centred care is about shared decision-making, shared responsibility. It's about genuinely and meaningfully involving patients in the way that their care is provided, keeping them informed, making them feel like they have control and can influence the way in which that care is provided. It's bringing in their family and friends and bringing in other, and making an integrated package of care between different types of services and really centering that system around the patient. So not the patient being kind of shuttled across different areas, but actually kind of thinking of it as a circle around them. It's about emotional support as much as it is about physical comfort, and it's building that emotional capacity to recover from what might be a very kind of traumatic experience. And I think, well, one thing to do. I mean, I think, as I said, what we really believe at NESTA and what we're really trying to test is that in order to get to that end point, in order to get towards a more patient-centred system, that actually the reform of that system and the way that you reform that system also needs to be patient-centred and also needs to involve patients in that process. And actually it's the process of doing that that would really make that transformation. This isn't a system which can be redesigned centrally and driven through kind of central structural reform, but it's actually a much more kind of iterative, locally adaptive approach that would kind of genuinely make patients feel that they could contribute to that. So I think co-design processes and ways in which you can kind of build patient engagement and involvement into that decision-making process and the reform process, I think those are starting to show real progress in terms of kind of the way in which services can be more effective. And then I suppose the challenge then is kind of scaling that from where it might be sort of pockets of good practice towards a kind of a general sort of system shift. But yeah, don't necessarily have the answer to that one.